In a single payer system, everybody would be in the pool, everybody would be covered. So you would start out with your, if it was the state of Maryland, you'd start out with your state of Maryland health insurance system card the day you're born, and you'd have it your entire life. The system would assure a comprehensive system of benefits for medically necessary care, and would have one standard of care for everybody, and would provide true health security. In a single payer system, most people would be paying less for health care when they count up all of their expenses than they are currently. In fact, we've hired an economist to do a study of single payer in Maryland, and the conclusion was that 95% of people would be paying less currently than they currently are paying for health care. In a single payer system, the economic barriers to care would be, there wouldn't be any, because you wouldn't have to worry about co-pays, deductibles, out-of-pocket expenses. People would just go to the doctor when they felt they needed to go. The out-of-pocket expenses are large for a lot of families. You can end up spending between premiums and deductibles. You can end up paying $10,000 or $15,000 out of pocket before you get any significant medical care. Well, in a single payer system, you would have your choice of any doctor or any hospital in the system, and since everybody's in the system, you'd have your choice of anybody. Well, in a single payer system, everybody would be in network. All the hospitals would be in network, all the doctors would be in network. You have someone looking over your shoulder, and a lot of the time, and it's the health insurer who's looking over your shoulder. They will tell you what you can and can't do, oftentimes, what medications you can prescribe, how long somebody needs to be in the hospital. People who've had long-standing relationships with their doctor, who trust their doctor, the doctor knows the patient. Very often people find that their long-standing doctor is no longer in network, and so they can't afford to go to that person anymore. But in the current system, first of all, because there are so many insurers and so many plans, to get paid, doctors need to have significant office staff that's dedicated to nothing but talking to insurance companies and sending paperwork into insurance companies, which is a total waste of time. It doesn't add anything as far as improving health care. In a single payer system, the emphasis is on primary care. It's on having people have a regular source of medical care. So when you have good primary care, you have good prevention, you have good disease management. Well, we know currently in Maryland that a significant number of people, 30 to 40% of people, report that they put off seeing the doctor because of considerations about payment, about not being able to afford going to the doctor. And under a single payer system, that would not be a consideration. You would, when you go to a hospital now or an emergency room, the first thing they ask you for is your insurance documents before they'll even see you, all of that would be gone. The person seeing you would just want to know what's wrong, and they wouldn't have to worry about could you afford to pay or couldn't you afford to pay, because that's already taken care of ahead of time by the way the system works.